Typhoid fever is a bacterial infection caused by Salmonella typhi that has affected populations globally, especially in regions with inadequate sanitation. The disease has been documented throughout history, with notable outbreaks influencing public health responses and scientific understanding. Typhoid fever primarily spreads through contaminated food and water. It occurs when human feces, containing the bacteria, contaminate water supplies or foodstuffs. This mode of transmission is particularly prevalent in areas lacking proper sanitation and clean water facilities. Historically, as cities grew rapidly during the Industrial Revolution, the infrastructure for clean water and effective sewage disposal lagged, creating prime conditions for the spread of diseases like typhoid. The impact of typhoid fever historically has been profound, leading to significant morbidity and mortality. During the late 19th and early 20th centuries, as urban populations exploded, typhoid fever became a major public health issue. Cities such as London and Philadelphia experienced severe outbreaks, which spurred the development of better urban sanitation and water systems. One of the most famous carriers of typhoid fever was Typhoid Mary Mallon, an asymptomatic carrier who was identified and forcibly isolated twice by public health authorities in the early 1900s after she infected dozens of people in New York City. In modern times, typhoid fever is much less common in developed countries, largely due to advances in sanitation, hygiene, and the availability of antibiotics, which can effectively treat the disease. However, it remains a significant threat in lower-income countries where access to clean water and adequate sanitation is not universal. Each year, there are an estimated 11–20 million cases and about 128,000 to 161,000 deaths worldwide due to typhoid fever. Historically, typhoid fever was a major public health threat, especially during the era of rapid industrialization when burgeoning urban populations often overwhelmed the available sanitation infrastructure. In the late 19th and early 20th centuries, the disease was responsible for high rates of morbidity and mortality in cities across Europe and America. Notably, the disease highlighted the role of asymptomatic carriers with the case of Mary Mallon, known as Typhoid Mary, who was linked to multiple outbreaks in New York City and ultimately quarantined for life after she was found to be a carrier who infected dozens. In modern times, the prevalence of typhoid fever has drastically reduced in developed nations thanks to improvements in water quality, sanitation, and public health measures. However, the disease continues to be a critical health issue in many developing countries, particularly in regions like South Asia and Sub-Saharan Africa. These areas, struggling with limited access to clean water and adequate sanitation, still report millions of cases and significant deaths each year. The prevention of typhoid fever has seen significant advancements through a combination of public health initiatives and technological advancements. The cornerstone of prevention is the improvement of water and sanitation systems to prevent the contamination that spreads the bacterium. The development and administration of vaccines have also played a crucial role in controlling outbreaks, especially in endemic regions and for travelers from non-endemic areas. Additionally, public health education campaigns have been instrumental in teaching communities about the importance of hygiene, safe food preparation, and the risks of contaminated water. The widespread use of antibiotics has greatly improved the outcomes for those infected, reducing the severity and duration of the disease and curtailing its spread to others. Surveillance systems have been established in many areas, enhancing the capability for early detection of outbreaks and facilitating rapid responses to contain them. Typhoid fever, once a devastating public health threat in both developed and developing regions, has seen significant changes in its impact due to advancements in public health, sanitation, and medical treatment. Historically prevalent in 19th and early 20th century urban centers in Europe and North America, the disease was dramatically curtailed in these areas through improved sanitation and the advent of antibiotics. However, it remains a critical concern in many low- and middle-income countries, particularly in South Asia, and parts of Africa and Latin America where access to clean water and adequate sanitation is limited. The bacterium Salmonella typhi, which causes typhoid fever, is transmitted through contaminated food or water. This pathogen can lead to symptoms such as high fever, fatigue, stomach pains, and headache, and if untreated, can result in death. Globally, it is estimated that typhoid fever affects 11 to 20 million people each year and causes between 128,000 and 161,000 deaths. Prevention of typhoid fever involves a multi-pronged approach focusing on both community infrastructure and personal health practices. Ensuring access to clean water and proper sanitation facilities is the most effective measure to prevent the spread of typhoid. This fundamental public health strategy includes the safe management of municipal water supplies and adequate sewage systems. Vaccination plays a crucial role in controlling the disease, especially in endemic regions or for travelers to areas where typhoid is prevalent. These vaccines significantly reduce the incidence of the disease and are essential tools in managing outbreaks. Education on personal hygiene is another vital component of preventing typhoid. Public health campaigns that promote hand-washing, safe food preparation, and general cleanliness help mitigate the risk of transmission. Such educational initiatives are especially critical in regions where the disease is facilitated by common local practices. Prompt treatment with appropriate antibiotics is crucial for those infected with typhoid fever. Effective treatment aids in recovery and reduces the disease's communicability, helping to prevent further spread. Lastly, maintaining robust surveillance systems enables health authorities to detect and respond swiftly to outbreaks of typhoid fever. Early detection is essential for controlling the spread and effectively managing resources to combat the disease. With ongoing efforts in improving infrastructure, expanding vaccination coverage, and enhancing community education, the global health community aims to reduce and eventually eliminate typhoid fever as a public health threat. The continuous battle against typhoid fever underscores the need for sustained public health vigilance and resource allocation to protect vulnerable populations worldwide.